Hi friends, welcome to my channel Pathology Master. Myself Dr. Parth Goswami and I am the consultant pathologist. Our today's topic of discussion is on the healing of the fractured bone. Now before I start my topic, this particular topic discussion, I request you to see the video regarding the cutaneous wound healing that was posted by me few days back in this channel so that it will be easy for you to understand the healing of the fractured bone. So let's start the discussion. Now, before starting any topic, the students should be familiar what are their learning objectives, which are the content of the lecture. The students should be clear what they need to know at the end of the lecture. So at the end of the lecture, you should be familiar with definition of fracture, that is basically introduction of fracture that include the definition and the types of fracture. You should be familiar that how particular fractured bone will repaired. You should be familiar with the factors affecting the bone healing. And finally, you should be familiar with the complications of the bone healing. So these three learning objectives basically clear almost whole aspect of the fractured bone. So the process of fracture healing is somewhat similar to like that of cutaneous wound healing. That's why I recommend you to see the video regarding the healing of the cutaneous wound first before seeing this particular topic. The only difference, the main basic difference in the healing of the fractured bone is the callus formation. This callus means bone formation usually not seen in cutaneous wound healing. So in this major way, these two particular mechanism can be differentiated. Now, what is fracture? Before starting the discussion on the healing of the fractured bone, you should be familiar what is a fracture. So this is your bone, guys, right? The bone is having the three layers. The outer one is periosteum. It is known as an periosteum, right? Below periosteum, there is a presence of cortex. So the second layer of the bone is cortex, and the inner one, this inner one layer is known as an medullary cavity. It is a medullary cavity. So there are three basic layers of the bone. So if there is any breach in the continuity of the particular bone, suppose this bone is getting cracked here or the continuity is lost, then it is known as an fractured. Right? Now, which are the types of such fracture? So you should be clear that fracture can be traumatic in the normal bone or it can be pathological. Now, what do you mean by pathological fracture? See, if your bone is weak because of any underlying disease like that of inflammation, like that of osteomyelitis, if you are having arthritis, if you are having osteoporosis, defective mineralization of bone, all that predisposing bony condition means if your bone is abnormal, then you are more prone for development of fracture, and such fracture is known by the name pathological fracture. The fracture can be of the incomplete or complete. The fracture can be simple or it can be means it can be close or it can be comminuted. What do you mean by comminuted or compound fracture? Means it will communicate with the outer skin surface. So prognosis of such fracture is poor. So it can be close or it can be communicating to the skin surface. So these are the certain types of fracture, right? Now we will see the basic types of fracture healing. Before I start my discussion, I would like to differentiate the fractured healing into two way. That is from the book HarshMohan, textbook of pathology, from the HarshMohan book. That book basically divides fracture healing into two portions, primary and secondary. Now, what do you mean by primary fracture healing? It's very easy to understand. I will teach you. Okay. So when the ends of the fracture approximated by the clamps or metal plate, then such type of healing is known as an primary fracture healing. Okay, this is your bone, right? Suppose you are having the fracture here and the fracture is somewhat severe. I mean, you cannot apply plaster cast here. So what will you do? You can do the internal fixation of this fractured portion by putting a metal plate. Suppose you are putting a metal plate here and you are doing the fixation with the help of screw. So such operative intervention by putting the plate, by putting the screw, that type of healing is known by the name primary fractured healing. In such type of healing, the necrosis is obviously more, the damage is more, and the healing is somewhat slow. Why? Because here periosteum callus will not form. We will see these steps later on in the slides, that how callus will form. But here you have to remember that callus is not formed in the outer layer of bone. Directly medullary callus will form. So you might have questioned that what is the advantage of such type of primary fracture healing? So the advantage is patient can be made ambulatory early as compared to secondary fractured healing. So this is basic regarding the primary fractured healing. Okay. Now we will see secondary fracture healing. How secondary fracture healing happen. So remember guys, it is a more common form of the healing. The most of the fractured bone healing occur in a secondary way. Here what happen? Suppose you are having the fracture here, then the doctor will apply plaster cast around it. You might have seen that some patients are being applied plaster cast for bone immobilization, and that is the very natural way of the healing of the fractured bone, and it is the common way of healing. Remember, the common way of healing is the secondary fractured healing, and we will take this type of healing as an prototypic example, and we will see which are the stage of the healing of the fractured bone in such way. So there are basically three way of the healing of the fractured bone. So which are that three stages? Remember guys, the first stage is pro-callus formation. The second stage is osseous callus formation. And the third final way of reunion of the bone, final mode of healing, that whole process is known as an remodeling stage. So there are basically three stage of the healing. We will see each stage one by one. Okay. Okay guys. So first stage of fractured healing is the procallus formation. Suppose you are having the fracture in the bone here, then what will happen? Just imagine, because of fracture, because of break in the continuity, your blood vessel will get torn, it will get damaged. So because of damage to the blood vessel, you will have the collection of blood here, and that is known by the name hematoma formation. So first the procallus process will start with hematoma formation. Then what happen? Remember the chapter of inflammation. Whenever you are having any injury, first of all, your platelets are getting activated, and then after, such primary hemostatic plug will be replaced by secondary hemostatic plug with the fibrin clot formation. So you will form the fibrin clot to stabilize the fractured portion, and that secondary fibrin clot formation will occur after bleeding. Okay, so first process is the hematoma formation and the fibrin clot formation. Okay, now what happened? In the fractured bone, this is your fractured area, right? So whenever you are having any type of damage, the first of all your acute inflammation will come into the action, right? First of all, there will be local inflammation after hematoma formation, and in the body, if any damage happen, then inflammatory system will get activated. And first of all, there will be obviously acute inflammation, that is by the cell polymorphs. So first of all, there will be local recruitment of the neutrophils. The neutrophils will get accumulated at the fractured site. So there will be accumulation of the acute inflammatory cell, particularly polymorphs. And you might remember that if you have seen the video regarding the cutaneous wound healing, then you might remember that after 3 to 5 days, acute inflammatory cell will be replaced by chronic inflammatory cell, and such chronic inflammatory cells are lymphocytes and the macrophage. Now, why such inflammatory cells recruit at the fractured site? So, as you might remember that the main purpose of the inflammation is to do the phagocytosis. The neutrophils and macrophage will do the function of phagocytosis. They will phagocytose the inflammatory exudates, red blood cells that are recruited there. Means they will try to remove the red blood cells. They will try to remove the inflammatory cells or exudates who have performed their function. They will try to remove the fibrin, and they will try to remove the damaged bone, necrosed bone. So they will try to remove the bacteria as well. So they will do the function of phagocytosis. So the local inflammation will happen. Okay, so this is the first stage of the fractured bone healing. Clear? This is the figure from the HarshMohan book, textbook of pathology. It's very beautiful figure. This is your fractured area. And here you can see that there is a formation of hematoma, blood collection. So this is the hematoma, this red colored, right? And in between that there is a presence of acute inflammatory cell, particularly neutrophils, and that will later on after 3 to 5 days will be replaced by macrophage, right? So this is the first stage. Okay, now what happened? Now there will be formation of granulation tissue. If you can remember the video of cutaneous wound healing, if you can remember mechanism of the cutaneous wound healing, then you might remember that in the chronic inflammation the two growth factors are released. Particularly one is vascular endothelial growth factor and another one is growth factor, transforming growth factor beta, platelet derived growth factor, right? So this will lead to new blood vessel formation, that is known as angiogenesis, and these growth factors will lead to fibroblast proliferation, that will lead to fibrosis. So fibroblast proliferation and angiogenesis, newly formed blood vessel is known by the name granulation tissue. Granulation tissue is nothing, it is the new blood vessels, means new capillaries and the fibrosis. So that is granulation tissue. But here additionally what happened in the fractured bone healing? Up to this stage the mechanism is similar like that of cutaneous wound healing. But what happened in fractured bone healing repair? So I will explain you by drawing the figure. Okay, this is your bone guys. Here there is a fracture, right? So what happened here? From the periosteum, this is your periosteum. From the overlying muscles, right? And from the medullary cavity, from these three area there will be recruitment of lots of mesenchymal stem cells. There will be recruitment of lots of mesenchymal stem cells, and these mesenchymal stem cells is having the function of forming the bone. What happened? You might remember that mesenchymal stem cells are somewhat multipotent. They can able, depending upon the biological behavior, they can get converted into I can say chondroplast, right? Or they can, or they can get converted into osteoblast, right? So they can form the cartilage from the chondroblast, and from the osteoblast they can form the bone. So the proliferated mesenchymal cells will form the cartilage and the bone, and that is known as an procallus formation. So this is the figure showing the granulation tissue. This is the new blood vessel, and here there is a fibrosis, that is known as granulation tissue, newly formed blood vessel and the fibrosis. And additionally there will be formation of the bone from the proliferated mesenchymal stem cells. So in addition to collagen tissue and the newly formed blood vessel, the bone will also form, and they will undergo calcification, that is known by the name woven bone. Remember guys, in the procallus the bone form is the woven bone. It is, I can say, woven means very weak bone. This bone is very weak, and at the poorly immobilized site fracture site like that of fractured rib, the cartilage will also form. So the procallus is consist of total four things. First of all, there will be newly formed blood vessel. Second one is the fibrosis. Third one is woven bone, and fourth one is cartilage. So the procallus is consists of these four things, and the main portion is woven bone and the cartilage. This cartilage will provide the temporary immobilization, and this procallus formation function is performed by periosteum layer of the bone, that is outer layer. So this is the figure that this particular figure is showing you the procallus formation. Here you can able to see the cartilage. All these are cartilage, and within it there is a formation of bone from the osteoblast. But this bone is very, I can say, a very weak bone. It cannot provide the sufficient integrity to perform the function. I mean, it cannot provide stability to the fractured bone. This weak bone need to be replaced by permanent firm bone. So this weak bone need to be removed after few days, and after few weeks, I can say after 3 to 4 weeks, this woven bone will be removed by osteoclast because it is weak bone. We need to remove it. It will be removed by osteoclast. Osteoclast is doing the function of bone resorption. The cartilage will also disintegrate with the help of osteoclast. Okay, now what happened after removal of the weak bone? There will be new firm bone formation, new strong bone formation with the help of osteoblast. The osteoblast will form the mature lamellar bone, and that is having the Haversian canal around the blood vessel, and that is your permanent bone. So the woven bone will be replaced by stronger bone, that is lamellar bone, and this stage is known by the name osseous callus formation. The formation of lamellar bone is also known by the name osseous callus. So this is your permanent bone and it is very strong. So this is the particular figure showing the osseous callus formation. So remember guys, this whole process starting from the development of the fracture to the new lamellar bone formation with the help of osteoblast, that whole process is known by the name bone remodeling. In the cutaneous remodeling, you might remember the name was given as in tissue remodeling, but here the name is given as in bone remodeling. And after remodeling, it is indistinguishable from the normal bone. It looks like a normal bone. So this whole process is known by the name bone remodeling. So this is your remodeling bone. You can able to see that fractured side is getting healed, right? So this whole process is the bone remodeling. So now you so now you can understand that there are basically three stages of the bone healing. The first one is procallus formation. That is that is consist of woven bone formation and the cartilage, fibrous tissue, and the blood vessel. So that is having the woven bone that need to be removed because it is a weak bone. It provides the temporary immobilization. We don't need woven bone, so it will be replaced by lamellar bone, that is a mature bone, and such a lamellar bone formation is known by the name osseous callus formation. So your second stage is osseous callus formation, and this whole process is known by the name remodeling, right? So this is all regarding the mechanism of bone healing. Okay, now we will understand our second learning objective, that is which are the factors that will affect bone healing. So remember guys, the factors that affect the cutaneous wound healing, that will affect the bone healing as well. So the first factor is obviously immobilization. In the fractured bone, if you will do the excessive movement, you will not immobilize your portion, or you will apply the too much weight on the fractured bone, then your bone healing will be delayed. So the first factor is movement, that will affect the bone healing. Second important factor is smoking. what happen if you are chronic smoker, then your blood supply is decreased to that area, and because of less blood supply, obviously your healing will get delayed. Third factor is diabetes and the vascular disease. Suppose if you are having diabetes or you are having microangiopathy at the fractured site, then the blood supply is less, and so your healing will get delayed. Suppose you are taking any immunosuppressant drugs like that of steroid or some chemotherapeutic drugs, yeah, then your bone healing will get delayed. So the steroid and immunosuppressant will delay your bone healing. Okay. If you are having local site infection or you are having comminuted fracture that is communicate to the skin surface, then obviously your healing will be delayed. If you are old age, suppose 60 70 year, then obviously your healing will be slow as compared to the young adults. If you are having malnutrition, you are having the vitamin C deficiency, you are having zinc deficiency, you are basically having the malnutrition, then it can affect your healing, it will delay your healing. So these are the factors, basic factors that will affect the bone healing. Okay, now we'll understand our third learning objective, that is the complications of the fractured healing. So can you imagine what can be the complications? Yeah, you are right. Suppose you are not doing the proper immobilization of the bone, you are doing the excessive movement, then what happen? You will not giving the time to the mesenchymal stem cell to get converted into the bone, so you will not develop bone, and there will be only fibrous union. The osseous callus will not form. Instead, you are having the fibrosis only, and that is known as fibrous union, and that will give the appearance of the pseudoarthrosis in the joint. And because of fibrous union, you cannot able to do the movement. Your movement will be restricted, and it can be painful. So the bone will not form. So that is the first major complication if you are doing excessive movement. If you are not immobilizing your fractured site. Okay. Second complication is the non-union. Suppose between the fractured side there is a interposition of some soft tissue, then union not at all develop. You need to remove such interposed soft tissue. So the second complication is the non-union. Okay. The most important complication is the delayed union. Usually what happen in most of the case, suppose your blood supply is poor because of diabetes, because of some vasculopathy, or you are having the infection in the local site, suppose you are doing the excessive immobilization, suppose you are old age, you are taking the immunosuppressant drugs. So as we have discussed, all these factors will lead to delayed union of the fractured site. So that was that is the third complication. So that was all about fractured healing. Again, I am summarizing in a very short, within 1 to 2 minutes, right? So our learning objective was to understand the types of fracture, how the fractured bone will heal, factors affecting the bone healing, and the complications. So the process is somewhat similar to like that of cutaneous wound healing. The types can be, it can be traumatic fracture because of some trauma, or it can be pathological fracture due to some underlying bone disease. It can be complete fracture or incomplete, it can be simple, or it can be communicating to the outer skin surface. The healing can be primary or secondary. If you are doing internal fixation with the help of clamps or metal plate, then it is known as primary fracture healing. Here, more necrosis, medullary callus will form, periosteum callus will not form, and the patient can be made ambulatory very early. Patient can walk early. That is the advantage. The natural form of healing by applying the plaster cast is known as a secondary fracture healing, and that is our prototypic example. There are basically three stages of the fractured bone healing: procallus formation, osseous callus formation, and remodeling. In the procallus stage, first of all, there will be hematoma. It will get stabilized by the fibrin clot formation, and there will be recruitment of the inflammatory cell. The first one is polymorph, that will be replaced by macrophage, and they will do the function of phagocytosis. So this is a figure showing the hematoma and the inflammatory cell recruitment. After that, there will be granulation tissue formation, that is a new blood vessel formation and the fibrosis. But the proliferated mesenchymal stem cell from the medullary cavity, periosteum, and the muscle will form the bone and cartilage. And such bone and cartilage formation is known by the name procallus formation. That formed bone will get mineralized, will get calcified, and it is known as an woven bone. It is a weak bone. We need to remove such weak bone after few weeks. We need to replace it by a strong bone, that is lamellar bone. So that function will be carried out by osteoblast. Right, osteoclast will remove such procallus. This is the procallus. Here there is a presence of cartilage, and this is the bone. So this weak bone will be removed by osteoclast, and then the firm, strong lamellar bone will be formed by osteoblast, and that is known as osseous callus formation. Okay, one more thing I would like to add is that the procallus is also mentioned as an soft callus in the few book. It is also known as soft callus. That will be replaced by strong osseous callus formation, and that is written in some book as an hard callus. So the another name of these two, procallus and osseous callus, is the soft callus and the hard callus. So this is the osseous callus formation, and this whole process up to the osteoblastic bone formation, this whole process is known by the name remodeling. Factors, obviously excessive movement will delay the bone healing. If you are doing this, if you are chronic smoker, then blood supply is less and it can delay the bone healing. Diabetes, steroid, immunosuppressant drug, infection, advanced age, all can delay your healing. Malnutrition also can affect the healing. There are basically three complications of the fracture healing. Because of excessive movement, the bone formation might not happen, and it will lead to only fibrous union. Sometimes if there is any interposition of soft tissue, then union not at all occur. That is known as non-union. And as I have mentioned, few factors can delay your bone healing. And remember, guys, that in the fractured bone healing, the painful stage is the up to procallus formation. After osseous callus formation, the healing is not much painful. So that is all regarding the fractured bone healing. Hope you have enjoyed this video. If you like my video, then subscribe my channel and press the bell icon so that you can get notified whenever I am posting such videos. Thank you very much, guys. See you again within few days.